In this video, I am going to answer a viewer's question about the bulgy disc and sciatic pain. I'm going to answer it in a way that somebody's come into my clinic and how I would explain it to them. So if this is similar to your kind of presentation, I hope this is useful to you. So my name is Nigel Willman and I'm a physiotherapist and have been for the last 25 years. I see people on a daily basis still, so I'm doing these videos in my limited spare time. A question came in from one of my viewers, so thank you for that in the first place. Hopefully this can help. I can only give general advice rather than specific advice. Obviously, it's not a replacement for seeing a healthcare professional, but some of this information might be useful to get you on the road to more recovery as soon as possible. Now, this particular individual said that they have L4, L5 bulging discs and a bulging disc at L5, S1. Now, what does that mean in principle? Well, in our spine, we do have discs, individual discs at each level of the spine, which are in between the spinal vertebrae. So what they're there for is to, first of all, they will allow more movement, because if it was just bone on bone, we wouldn't have such flexible spines. They also give shock absorption, and so that means that we can jump off things and it not be a big jar onto our joints. Now they're made up of an inner portion, which is a more squashy bit. Think about like something like toothpaste. And then on the outer portion of it, you have more bone-like structure. And so this is a great design because it allows shock absorption to take place, but also structure to be maintained. So when things go wrong, well, first of all, where are the L4 and L5 and L5S1 discs? They are right at the bottom of the back. So where most leverage takes place. So right at the bottom of the back, in contact with the sacrum, is the L5, S1 discs. And then the next one up is the L4, L5, and that is because they are between those vertebrae. Now, this individual said that they've got bulging discs at this level. Now, bulging discs effectively mean that the perimeter of the disc has exceeded the width of the vertebrae. Now that means that the consequences of which can mean that sometimes that bulgy bit of disc can push onto the nerve and cause sciatic pain. Now I say sometimes because that is not always the cause of sciatica, and it's certainly not always the cause of nerve-related pain down your leg, and there is a distinction between the two things. And I'm assuming they've had an MRI scan, because otherwise you wouldn't be able to tell if they'd had bulging discs. Now I have done a video about this, so I'll put that link in the description. But basically, they did a study of people with no back pain, and they looked at them in age categories. And so 69% of people in their 60s had bulgy discs and no symptoms. 77% of people in their 70s had bulgy discs and no symptoms. And 84% of people in their 80s had bulging discs, but no symptoms. And so you can see there that having a bulgy disc does not necessarily mean that you have sciatica. And indeed, it doesn't mean that it is the cause of radiating leg pain down the leg. So it's a difficult one to think, if I have a scan, it shows me this, that's the cause of my problem. Whereas this individual's problem may not be related to discs at all. In fact, it's unlikely that it is the disc, I would say, because they've had nerve root injections with no success, which would indicate that actually the nerve root itself is not the source of the problem. So what is the source of the problem? Well, it'd be impossible for me to say exactly what the cause is. In fact, I never can say really exactly what the cause is, but we work on principles when it comes to treatment. And the principle is that tension, restriction, irritation around a nerve causing radiating leg pain is usually there for the reason that there is stiffness or tension around the lower back structures. And therefore, exercises, stretching, can help to mobilize those structures, resulting in an improvement in the problem. This is borne out by the fact that the vast majority of sciatic symptoms do resolve, even on their own, with no intervention. They will sort themselves out. But if you were to MRI scan that person with sciatic pain with their bulgy discs, once they recovered, if you MRI scan them again, the bulgy disc would still be there. It's made no difference in terms of structure, but the symptoms have resolved, largely because tension or mobility has been restored over that period of time. So we've established that exercise is a really, really good way of helping to get rid of sciatic symptoms. So this person wanted exercises, but they found it difficult to get off the floor, and so therefore they wanted exercises that were more upright. And so what we're going to do is run through some sitting exercises and some standing exercises that I would give to the sort of individual. I'm making the assumption that they're slightly older and the problem is probably related to stiffness around the lower back and pelvis. So these exercises are on the basis of mobilizing that particular area. Now, the golden rule for exercises is that you do not do exercises that increase the sensation of leg pain. So if there are any exercises that do that, please don't do them. We want to listen to our body and do things which are comfortable to do, but get us moving. So the first thing we're going to do is some simple pelvic tilts in sitting where we relax down and we sit back up. So we're basically slumping down and then sitting upright as much as we can onto the bones of our bottom. We slump down, we lift up. Now what's that's doing is it's helping to mobilize those segments in a way that is not too stressful, it's not too quick, it's not too loaded, but it's just gently working those small muscles and tendons and joints at the bottom of our back. And so I would recommend doing 10 repetitions of that in a row. So the next thing I would recommend is doing some simple sitting rotations. What we're going to do is sit down in a nice upright posture and put our hand on the opposite knee and then turn our body round to one side and then bring it back and then repeat on the other side. So we're going to simply go very carefully and nice and smoothly from side to side. So we don't want to look too jerky. We want to just go from side to side. And I would recommend doing that 5 times to each side. And what we're doing there, rotation is a fantastic exercise for the lower back in terms of mobilizing. Providing it's done in a controlled way and not too quickly and certainly not loaded, it's a great way of mobilizing the lower back. So now we're going to perform some exercises in standing. We need something to hold on to for balance, and we need to make sure that anything we do, of course, does not increase our symptoms. So to begin with, what we're going to do is hold on to our support and lift up one knee up and down. So lifting the knee up and down helps to stretch around the hip muscles, slightly bend the lower back. It can be very, very comfortable to do. If you have a problem standing on one leg, you might want to hold on with 2 hands in front of a surface, which gives you a nice good support. But basically lifting up and down 10 times and then lifting up and down 10 times on the other side. Really simple thing you can do while you make a cup of tea or cup of coffee. You can simply do those exercises. Obviously, if you have difficulty in standing on one leg because of pain, then you might want to avoid doing that particular exercise. The next thing you're going to do is basically tilt over to one side at the waist, tilt over to the other side at the waist, alternating if you can. Now you might find with sciatic pain that if you go to one side, it might increase those leg symptoms. If that's the case, then don't do that side. You might want to avoid doing that side. So if I had pain when I went to the right side down my right leg, what I might do is just simply move to the left side and back up, to the left side and back up. And you tend to find as you get a bit better, the symptoms actually improve and you can start to move to the side that used to be painful. So once you've done 5 repetitions on each side, I will then work in the backwards direction. So holding onto our surface, we would then bring our hips towards our support by arching backwards just as comfortably as we can go, making sure that we're not going to fall backwards, but holding onto our surface. And you might want to have something behind you like a wall that just in case if you lost your balance would be there to support you. Anything you should do in terms of exercises should always be done in a safe way. So be careful with that. So I hope that information was useful to you. Feel free to put some comments below. I'd love to hear from you. And of course, if you like this video, then like it. And if you like this content, then subscribe. That would mean the world to me. Thanks a lot.